Hi, I'm Dr. Ellie Campbell, COVID style. Here we are in 2021, and COVID-19's been with us for a little bit over a year. As a result of this pandemic, we're now beginning to see about 10% of patients suffer from COVID long hauler syndrome or post-COVID fatigue syndrome. It's sad that it's not yet well understood that there's some treatments that are available for many of the symptoms that these patients suffer from. About 10% of patients will be completely disabled as a result of having COVID. And fortunately, in Campbell Family Medicine, we don't really see any of these patients because we spend a long time before we ever get infected with COVID, taking care of our patients and treating the root causes. It's important, I think, to recognize that COVID is really a pandemic within a pandemic. Before the virus ever got here, Americans were suffering from chronic inflammation, toxicity, mitochondrial insufficiency, and nutritional deficiencies that made them so susceptible to get the worst of COVID. Now these long haulers are suffering from fatigue, mild to severely disabling, muscle aches, muscle exhaustion. They're suffering from weakness, brain fog, cognitive impairment, from loss of endurance, loss of sex drive, hypersensitivity such that lights and sunlight and sounds, even smells, are overwhelmingly irritating to their nervous system. Anxiety, depression, insomnia, skin rashes, hair loss, so many symptoms in this long hauler syndrome. Fortunately, we believe much of it can be fixed. There's 5 contributors that we have identified that we can test for and treat. Toxic burden, pesticides, herbicides, mold toxicity, chemicals. Mitochondrial insufficiency, where the body can't make enough machinery for energy. Nutritional deficiencies that we can blood test for. Inflammatory burden that I can test for and treat. And neuroinflammation, we have treatment for that as well. So if you're suffering from the post-COVID long hauler syndrome, please seek out help from an integrative care practitioner. Campbell Family Medicine is well positioned to take care of you. We'd love to have you here in our practice. This is Dr. Ellie Campbell with Campbell Family Medicine.